In today's lecture, we will discuss about the cardiac cycle. We have already seen that cardiac cycle represents the electrical and mechanical events occurring in one heartbeat. So, first we will understand the electrical events that occur during a single beat. Suppose that this is our four-chambered heart and this is the SA node, sinoatrial node. This is also known as pacemaker of the heart because impulse is generated at maximum rate at SA node. So the impulse when generated at the SA node travels to the AV node, atrioventricular node. It travels to the AV node via the internodal tracts. An impulse also spreads to the atrial musculature. After the AV node, the impulse travels to the bundle of His. And from the bundle of His, it travels to the bundle branches, the left bundle branch and the right bundle branch. Bundle of His, and then to bundle branches. And finally, to the Purkinje fibers. As the impulse travels from the SA node to AV node, it leads to atrial depolarization, which is followed by atrial repolarization. Similarly, when the impulse travels from bundle of His to bundle branches and finally Purkinje fibers, that is, when the impulse spreads through the ventricle, it leads to ventricular depolarization, which is followed by ventricular repolarization. This atrial repolarization merges with the ventricular depolarization. Now, as the atrial depolarization occurs, it is followed by atrial contraction, leading to atrial systole. Similarly, repolarization of atria is followed by atrial relaxation, leading to atrial diastole. Again, ventricular depolarization is similarly followed by ventricular systole, and ventricular repolarization is followed by ventricular diastole. Now we can see that the events such as depolarization or repolarization of the chambers of the heart are known as the electrical events. And these electrical events lead to certain mechanical events in the form of systole and diastole. Thus, these electrical and mechanical events which occur during a single heartbeat represents one cardiac cycle. We have seen that cardiac cycle represents the electrical and mechanical events occurring in one heartbeat. We know that our heart beats for around 70 to 80 times in 1 minute. On an average, this is equal to 75 beats per minute, we can say. In other words, we can say that for 75 beats, it takes around 1 minute of time, or we can say 60 seconds. Therefore, for one beat to occur, that is for our heart to beat for a single time, it takes around 60 by 75 seconds. That is equal to around 0.8 second. So, cardiac cycle represents the event occurring in single heartbeat. So, we can say that the duration of one cardiac cycle is 0.8 second. Duration of one cardiac cycle will be around 0.8 second. We can understand the cardiac cycle events by certain diagrams. Like this blue colored circle we have drawn. This circle represents the atrial events. Similarly, this pink colored circle represents the ventricular events. So the outer blue color circle which we are seeing represents the event going on in atrium of our heart, and the inner pink color circle represents the events going on in ventricle of our hearts. Together, these two circles represent one cardiac cycle. The duration of which is 0.8 second. So if we divide this cardiac cycle in 8 equal parts, like this. If we divide this cardiac cycle in 8 equal parts, each part will represent 0.1 second of the cardiac cycle. So if we begin from here, this part on the outer circle represents the atrial systole. This shaded region in red on the outer circle represents the atrial systole. This is of around 0.1 second in duration. The rest part of the outer circle represents the atrial diastole, which is of 0.7 second in duration. 1, 2, 3, 4, 5, 6, 7. Similarly, on the inner circle, if we see, this shaded region in blue represents the ventricular systole. We can clearly see that this will be of 0.3 seconds. And the remaining region on the inner circle represents the ventricular diastole. So that will be of 0.5 seconds. Thus we can say the duration of atrial systole is of 0.1 second, and the remaining portion of 0.8 second is of atrial diastole, so it will be 0.7 seconds. Together it will come to be 0.8 second. Similarly, duration of ventricular systole will be 0.3 seconds, and that of the ventricular diastole will be 0.5 seconds. Again, adding up these two, 0.8 seconds. So we can see this circular representation of the cardiac cycle. In order to understand the further minute details of the cardiac cycle, we need to memorize this diagram. We need to keep this diagram in our mind.